Social determinants of health. By the end of this presentation, you will be able to describe social determinants of health. Social determinants of health are defined by the World Health Organization as the condition in which people are born, grow, live, work, and age. They are a result of unfair distribution of money and power. When resources are not fairly distributed, certain groups of people are greatly impacted. Social determinants of health play a large part in the health inequities that are faced by members of these groups. Some examples of social determinants of health include the availability of resources for people to meet their daily needs. This includes things such as safe housing, healthy food options, and clean water, and prevents access to things like medications, vitamins, and cleaning supplies to promote sanitary environments. Access to opportunities can include access to educational, economic, and job opportunities. Those with better educational opportunities tend to have more job opportunities that lead to economic stability. Without access to these opportunities, many individuals struggle financially. Lack of access to healthcare services greatly affects an individual's health status. Barriers to accessing health services include high costs for treatment, lack of insurance coverage, and limited language access. For example, when someone does not have health insurance, they may be less likely to receive preventive care and more likely to delay medical treatment, resulting in unnecessary emergency room trips and massive medical bills for the uninsured patient. These barriers lead to unmet health needs, delays in receiving appropriate care, lack of preventative services, and preventable emergency room visits. Public health and safety measures can affect the overall health of communities at large. Poor air quality can lead to increased problems with asthma, allergies, and other preventable respiratory illnesses. Lack of government funding for public health reduces access to health department resources such as free vaccinations. Educated individuals typically possess the knowledge and skills that can lead to healthier behaviors, like choosing healthy foods, vaccinating themselves and their families, living in a clean environment, and knowing when they should seek medical care. Health literacy is how much a person can process and understand basic health information needed to make appropriate medical decisions. Low health literacy is more prevalent in older adults, minority populations, those who have lower socioeconomic status, and other medically undeserved populations. Residential segregation essentially stands for the barriers one has to accessing medical care due to their residential situation. It might be difficult for someone to access medical care if they live far from the nearest hospital or health clinic. Many rural or underdeveloped areas lack public transportation to help patients get to a doctor. This may also impact someone who lives alone. Those who live alone, especially elderly people, can sometimes have poorer health outcomes because they do not have somebody else helping to monitor their health status and transporting them to appointments. Social norms and attitudes, including discrimination and distrust of governments, can affect an individual's health. Those who are worried about being discriminated against, whether it be because of the color of their skin, their religious beliefs, or perhaps even embarrassed by their health condition, often choose not to seek care even when they know it is warranted. This was seen as an issue when HIV was first discovered. HIV-positive patients were afraid to seek treatment for fear of discrimination. Living in and around crime and violence creates poorer health outcomes and mortality rates for individuals in these communities. Those who live around gun violence carry an increased risk that they will be involved in gun-related violence at some point in their life. Poor socioeconomic conditions have been found to cause a number of health problems for individuals. Aside from the financial inability to access health care, those who live in substandard conditions are more likely to be exposed to lead poisoning, pollution, and allergens, and can cause or exacerbate asthma and other respiratory illnesses. This can also affect an individual's working conditions. If someone is constantly sick from their environment but does not have sick time, they are more likely to either come to work sick and spread illness to others, or they will take time off without pay and may potentially risk their jobs. Disadvantaged neighborhoods also typically have less availability of fresh produce, more fast food outlets, and fewer recreational opportunities, all of which can lead to poor health outcomes. Even access to mass media, including cell phones, the internet, and social media, can impact a patient's health. Mass media is a great way to educate the public on public health issues and spread important health and wellness information. It can also allow people to make virtual or remote contact with healthcare providers when they otherwise would not have had access to medical care. These social determinants of health affect a wide range of health, functioning, and quality of life outcomes and risks for people living in the impacted communities. Not only do these groups of people experience material hardships, but where they live affects their sense of security and well-being. Addressing social determinants of health is an initiative that health leaders around the globe are working toward to ensure better health outcomes for all.